In this video, I'm going to show the physical assessment of a client, Harry, who comes in hospital with the chief complaints of chest pain. So I'll start with taking the history collection, and then after I'll do the pain assessment, and at last I'll do the physical assessment of cardiovascular system. So here goes our starts our conversation. Hello.
Hello.
How are you?
Good. Thank you.
What is your name?
I'm Harry.
So how old are you?
I'm 44 years old.
So what is your marital status?
Marital status, I'm married and I have 2 kids.
Okay. Do you have present and past medical history?
Yeah. Not exactly. No.
So what about this surgical history? Did you undergone any surgery before?
No, I haven't been through any surgical treatment.
So what about this family history? Like, do you have any history among your parents?
Yeah. When I was a teenager, my father passed because of heart attack, and my mother had a stroke as well. And my uncle, my one and only uncle, he also had an heart attack, and a few years back he also had heart surgery because of the heart attack.
So what are the symptoms you are facing right now?
Currently I'm here because I was having a severe pain in my chest. Last week I went to the GP, but it was kind of like I was facing a chest pain, but it was not that severe. But after I went to the GP, I started to there is an elevation on my blood pressure, so
Okay.
so that's why I'm here today.
Harry, now I'll assess your pain by using some pain assessment tool. So first I'll ask you about the position of pain. Where is the pain?
It's in my chest.
Okay. So what makes the pain better?
Nothing.
Nothing means?
Nothing. It's like I'm having pain for.
Did the pain occur at rest or during exertion?
Both.
Both?
Yeah.
Okay. Does the pain change during repositioning?
Repositioning, by you mean like if I
If your pain really, if you
so no matter which position I'm in, I'm having this pain.
Describe the pain or discomfort, and that means if you are having the type of pain like dull, squeezing, cramping, or some crossing. What type of pain?
It's not specific, but sometimes it's dull, sometimes it's severe. Mostly it's severe, so yeah.
Okay.
That's random.
So does the pain radiate to any other areas?
Yeah. Since few days back, the pain started radiating to my left arm towards my rear shoulders. So that's
From
happening.
the chest, first you got the pain in chest, and then now it reduced towards.
Yeah, exactly.
Okay. So so severity. So can you rate the pain out of 10? Like from 0 to 10, how much pain you are having right now?
It's because of the severe pain that I'm here, so I rate it 9 out of 10.
Okay, so you're having severe pain. So are you experiencing any other symptoms?
Yeah. Since a couple of days back, as I mentioned earlier, that I went to check up for the flu, but my blood pressure started to radiate. So since last few days back, I started to have nausea, I started to have headache.
Okay, so is there any other symptoms besides
no, that's basically it.
Okay, then time. So how long have you had the pain? Since how many days you are having the pain?
Even the chest pain?
Yeah.
So yeah, I started to have. I thought initially it was flu, but no. So let's say it was a week and few days that I started experiencing this chest pain.
So was the onset of pain slow or the sudden? I mean, like the pain starts suddenly or slowly?
No, I I still have the pain, so it doesn't radiate or it doesn't builds up. It's there.
Okay, all right. Is the pain intermittent or it is continuous? I mean, intermittent means suddenly it start and stop, or it is continuous?
No, it's just continuous.
Okay, all right. So, have you had the pain previously like this?
No, not as I recall. No.
Okay, all right. So here we finish our. So I finished my this pain assessment. So we'll move forward to under assessment, that is cardiovascular assessment. Then I like in that I'll be inspecting, palpating, and just listening to your heart sound. Is that okay?
Yeah, sure. Yeah,
Okay.
sure.
After performing the pain assessment, then I'll move forward to cardiovascular assessment. In this, I'll be doing 4 techniques, that is inspection, palpation, percussion, and auscultation. In palpation, I'll just observe the patient's skin color, the symmetric of this thoracic cavity, and any bone deformities, eyes, neck, and ears. Then breathing pattern can be also noted during this observation, if the patient is having this shortness of breath or not. So in case of Harry, the Harry had this pale skin, but he doesn't have any shortness of breath. So and other things that might be observed is cyanosis, if there is any bluish discoloration in the skin or not, or any vasoconstriction. If it is present, then it might indicate that there is this less oxygen supply to this heart. So palpation means assessing the client by touching. So in this, we will just check the client if we found any deformities during observation. So skin temperature, moistures, or any tenderness can be examined. So examination of the extremities can be also done, like if there is edema present in the ankle, feet, or feet and abdomen. So edema can indicate the cardiovascular problem. So in this, we can monitor the pulse rate and the heart rate for a full minute. So if there is any alteration rate, then it indicates there is a problem with the heart. So and after that, the patient can be moved to assess the jugular vein. So if it is distended, then we can indicate that there is a problem related to heart. And the third step is percussion, but percussion is used very limitation in cardiovascular assessment. So we'll go directly move towards the auscultation. That auscultation means hearing the sound of the heart. That means we put the stethoscope in in the heart side of the patient, so that we can hear any abnormal sound like murmurs or the second sound if there is problem. So in case of Harry, there is no any abnormalities with this heart sound. So here we finish our physical assessment. So whenever patient arrives with chest pain, we should mainly focus on pain assessment and cardiovascular assessment.